Hello, my name is Stuart. I am a nurse practitioner student. Today we are here with Maggie. We are going to do an assessment today on the head, the ears, the eyes, the nose, the throat, the skin, and the hair. So we're actually going to start with the hair and the head. So first thing I'm going to do is I'm going to look at her hair. I am going to make sure that there is no nits, there's no lice, and then I'm actually going to check her scalp to make sure that her scalp doesn't have any lesions in it. I'm going to make sure I don't see, again, any nits or anything like that. I'm going to check her head, make sure that it doesn't have any tender spots, there's no bumps in it. I'm actually going to look at her eyebrows and her eyelashes to make sure that her hair is there symmetrical. I am going to check her jaw for TMJ. Can you open it for me? Open, close. Thank you. And then we are going to check the rest of her skin. So I would actually look at her skin. I check her skin temperature with the back sides of my hands, and I would do that all over. I would check her back to make sure that her back, the temperature is good. There's no any kind of freckles or any lesions or anything like that on her. I'd also check to make sure there were no scratches and no bruises to make sure that she doesn't have any personal violence against her. And then I'm going to check her nails. Her nails, I'm looking for hygiene. I'm also looking for any ridges on her fingers. And then let me see your toes. I'm also looking for any clubbing, and I don't see that on either one of those. I'm going to check the tinting on her skin by pulling up on her hand there, and that's going pretty good. And then I'm also, and that checks for dehydration. And then I'm going to check for the capillary refill, and those are going pretty good, less than 3 seconds. And then I will also check on her clavicles for the skin trigger, and that's really going good too. So with that, we're going to look at your eyes. I'm going to look at her sclera. Those are nice and white. I'm going to pull this down, and those are nice and pink. We are going to do an eye test with my Snellen eye chart. And if you could stand up for me and take your left hand, cover your left eye, and that's actually 6 feet away, and read the smallest line that you could for me.
DHJBS.
Very good. And with the other eye?
LPTZO.
Very good. And then with both eyes?
OFDHJ.
All right, great. So have a seat there. So I will take note on what those actually are. We are going to do the fields of vision, and you let me know when you can see my hands, okay?
No.
Very good. And one more time.
No.
And then one more time.
No.
Very good. We are going to do the 6 cardinal views of gaze, and this is going to test your ocular muscles. So if you could follow my pen and just with your eyes and not your head. Very good. I'm going to take my pen light. I'm going to come in from this side, so just look at my nose here. Very good. I'm going to do this side. Very good. Her eyes are round and equal, and they react to the light. So if you would just look at my nose one more time for me, I'm going to do it again. Very good. And I'm looking to see that her other eye actually dilates when I do that. I'm also looking for debris in her eye, and I don't see any of that. So we are going to do a fundoscope exam with my ophthalmoscope. And I am going to use my left eye with her left eye, and I am looking at the blood vessels in the optic disc. And then if I move slightly over, I can see the macula. And I'm going to do it again with this one. All right. And then we are going to go to the ears. So with her ears, I'm looking on the outside of it. I'm looking for exudate. I'm going to tug on them up and back to see if there's any pain. Is there any pain? All right, so, and I'm looking at the outside, making sure that there's no exudate coming out of it and there's no infection. And then with an adult, you pull it up and back, and with a child, you pull it down and back. I'm gonna look inside her ear. And inside this ear, I can see that her eardrum is nice and pearly white. I can see the malleolus bones, and I can also see that the mucosa is nice and red. But it's not painful. But in this ear, it is full of wax. All right, so we are going to do the whisper test. So if you could close this ear for me, and then I'm going to whisper something.
Baseball.
All right, and if you could close this ear.
Apple.
Very good. So we are going to look at your nose. If you could look up for me. And I am looking for a deviated septum. I'm looking to make sure that her mucosa is good. I'm looking for any polyps, and I do not see any of that in there. So with that, we're going to move on. We also look at the nose itself, and as long as the nose itself is not deviated, we know it's not broken. There's nothing else that's there that's going on with it. Could you open your mouth for me? So, can you say ah? All right, so I was looking inside of her mouth. I was taking note of the what her teeth actually look like. Can you lift your tongue up? And then I was also looking at the mucosa. Her uvula is centered. Her tonsils look great. They're nice and pink like they actually should be. And then I was looking at her submandibular and sublingual glands. So with that, we are going to inspect the neck. We are going to look at her throat, and that does not look deviated in any way. So we are going to inspect her lymph nodes. So this one here is the periauricular. That's in front of her ears, and then behind it is the postauricular. And then under the jawbone here is the submandibular. Then we have the submental, and then the anterior cervical, the precervical, and then these are the supraclavicular, and then this is the intraclavicular, and then back here is the occipital. So with that, we are going to do the thyroid, and I'm going to do that from behind her, and I'm just going to feel for her thyroid. And then if you could swallow for me, please. One more time. Very good, very good. And then with that, I am actually going to listen for Rui. And I do not hear one. So, and also, obviously, we look at her throat, we look for a goiter, and she doesn't have one. So, with that, that actually ends our examination. Thank you.